Sometimes life gets hard, and I don't know where to start. Sometimes I feel like a failure, but that's not what's in my heart. I think about my little babies, and I begin to smile. Then I pull myself together and try to run another mile. As a woman, I know my worth. Yeah, I'm gonna make it. Gotta follow my dreams, put myself first. Oh yeah.
Hey, Black America. When COVID-19 hit America, it was not just a once-in-a-century pandemic, but also a societal tsunami resulting in life as we know it being changed forever. And with Black and brown people being disproportionately affected by COVID-19, the stress of being Black in America is literally not just making us sick, but is also causing us mental havoc and psychological challenges on a daily basis.
It is so imperative and so important for us to check on each other and to make sure we are doing okay mentally. Where we are mentally is what's going to affect how we build and raise our families, how we build and raise our communities, ultimately our neighborhoods.
A healthy body equals a healthy mind. So engage in long-term strategies such as regular doctor's visits, healthy eating, exercise, meditation, prayer, and engaging in overall healthy lifestyles.
I have built a very protective box of my personal space and of my mental space. So I keep people around me that encourage me, that lift me up, that make me laugh, that make me feel good, because that's important.
Finally, we need to break the stigma of addressing mental health issues in our Black community.
For very long, it has been taboo to seek mental help, mental attention. And at this day and age, we have to do whatever will work.
So if you're experiencing some serious mental health challenges, in addition to prayer, you can also talk to a therapist or clinician about how you've been affected by the stress of COVID and its aftermath. Brothers and sisters, we are in an unprecedented time in our American history, and living while Black is more stressful than it has ever been before.
I get out there and I put in the work to see the change. And I think mentally we feel defeated if we're not out there actually helping to be a part of that change. And I have refused to feel defeated. I have refused to feel like my voice doesn't matter or my work is in vain.
This is our voice.
And this is our movement.
Hello, everybody. Welcome to the Journey of Womanhood. I am Co-Pastor Michelle Limes, and I welcome you on today. Today, we'll be talking about a very serious matter, mental health. You recognize that 1 out of 8 women, or 2 out of 8 women, are affected by mental health every day. So we need to have to join in the conversation. This is something that we need to talk about. This is something that has been somewhat a stigma in our community. But we need to talk about this thing and conquer this thing, because we have a lot of women and men that are dealing with mental health and do not know the resources, do not know where to go, and do not know how to manage. Today, I'm so excited that we have Shronda Cowling. She is joining us today. She is a mental health consultant, and she's going to talk to us today in reference to the clinical side as well as the relative side of mental health. You all listen, tag. Invite a friend, invite a sister, invite anyone that you know that will benefit. Well, should be everyone will benefit from this, from these resources. We've been talking about mental health all week long, and we're going to continue on tonight. Thank you for joining us, and we're getting ready to meet our special guest, Shronda Cowling.
Shronda Cowling is a 1991 graduate of the Morgan State University, where she received a BA in telecommunications. She completed a postgraduate program at the University of Maryland, Baltimore in 1997 and holds a master's degree in clinical social work. In the spring of 2017, Shronda completed a certificate program in early childhood mental health through the University of Maryland's Child Psychiatry Department. She has worked a number of years doing trauma work with young children, early childhood mental health consulting, school-based counseling, and training. She is also a member of Delta Sigma Theta Sorority Incorporated. Ladies, please welcome to the stage, Shronda Cowling.
Hello, hello. I'm so excited on today. We are still, we're going to continue our conversation on mental health, ladies. Tune in. Listen, don't forget to tag. Don't forget to invite a friend, invite a sister, because we are going to talk about self-care, frustration, stress, anxiety, how depression, how it just affects our everyday life. Women, we need to talk about this. Today I have a wonderful woman. Her name is Shronda Cowlings, and I'm excited that she's here with us today. And hey, Shronda, how you doing?
Hello, how are you?
So we're going to have this conversation about mental health. We've been talking about it all week long. And I believe mental health does not need to just be spoken about in May. We need to talk about this all the time, because it's very important, and it's especially in our culture, it has become like a stigma, and people don't really want to talk about it. But we're going to talk about it. We're going to tackle this thing so we can be aware and have more education about what's going on. So can you just first let us know what do you do in reference to mental health?
Good morning, and thank you, Michelle. So I am a licensed clinical social worker, and I have a specialization with families and children, but primarily doing early childhood mental health work. So in addition to school counseling. So I work with programs, early childhood programs such as Early Head Start. I do consultation for them related to early childhood mental health. And I also do school counseling because, as you may know, there is a tie-in between social emotional functioning and academic functioning. And so we want to make sure that our children show up ready to learn. Obviously, we come into a setting with more than just books in our backpacks. Sometimes we have, things that we're weighted down with, and we want to be able to have children be in the best position for learning. So I take a lot of pride and pleasure in doing not only the early childhood piece, but also the school counseling. And I also do, I have a small private practice where I work with families, and you can't be with the child without connecting with the family. Obviously, they're the foundation. And so I do individual work in that way. And I do training related to trauma work and early childhood mental health.
Wonderful. And we're going to talk about the childhood mental health a little later on today.
Sure.
I want us to discuss mental health in women. And I know that because you are in the mental health field, I'm sure you deal with that as well. So as women, we have a tendency to do. We internalize and we don't always operate in self-care. And how do you, in your experience, how have you dealt with women with the mental health piece, and how have they been able to maneuver through that, and especially in our community?
Sure. So the statistics state that more than 1 in 5 women in the United States experience a mental health condition, especially in this past year. And obviously, we know with COVID, it has brought about numerous challenges for us all, especially the woman, who oftentimes we are in roles of juggling multiple hats and or balls in the air, if you will, from trying to work and possibly telework this past year to being the mom, the cook, the custodian, the teacher, so there are lots of things that are sort of plaguing us emotionally, and that's in a general way. But when you think about these environmental stressors that we call them, that we don't have any control over, like a global pandemic,
Yes.
it certainly weighs us down. And so, one of the messages that I have given to the moms or the women that I work with through parent child therapy is just thinking about this notion of identifying what the stressors are. And it could be that you're feeling overwhelmed. It could be that you're feeling weighted down by trying to juggle and balance work and home life. It could be relationship problems. It could be work related problems. So once they are able to identify those stressors, looking at how much is it impacting functioning?
Yeah.
And so, is it impairing your ability to get out of bed, to put one foot in front of the other, to engage with your children or your partner? So, if that is the case, then we could possibly be looking at a mental health diagnosis, and certainly want to have families be engaged in therapy, or have women take a look at engaging in therapy, as is the case for some of the families that I see with small children.
Yeah.
And to do that in an ongoing way, where it could be various modalities, whether it's family systems therapy, cognitive behavioral therapy, just to process out those things that they are experiencing that are weighing them down and impacting them negatively, and to ideally come out on the other side with coping skills and an ability to engage more fully.
Yeah. Now, being as though you work with families, this has, that might have dealt with trauma, and then you have the mommies that are trying to manage and,
Sure.
and mother at the same time, manage their own traumas, their own emotions and situations, and being mommy at the same time. Have you ever experienced mommy might can't love or can't do the things that we would usually do as mothers because they're plagued down with their own struggles, their own demons, the things that they're dealing with? And how do you all help them in those type of situations? Because me working with children as well, everything that goes that's at home spills over. It spills over in the schools, um, and even in the workplace. So how do you kind of help them maneuver through their own struggles? And I know you have coping mechanisms and different resources, but can you just name a few of things for a mother that might be listening now that's like, listen, I got stuff going on. I'm dealing with baby daddy issues. I'm dealing with my own struggles, my financial situations. I've been abused as a mom. So how do I love my child the way that I've never been loved. I've never even experienced that type of love that I want to reciprocate to my children. So how do you all manage or help these women that are in these type of situations?
Sure. I think in situations like that, you speak about trauma and the impact of multi-generational trauma. In those instances, it's important for that parent to recognize what they're grappling with,
Yes.
and it can be difficult to identify, but the hope is that they are engaged with a caring provider or professional who can get them, or a loving, caring family member
Yeah.
who
Yeah.
helps them understand what you're dealing with isn't your fault.
Hmm.
There were some things in your past that impact your ability to attend and attune to your child.
Yeah.
We know that if there is multi-generational trauma, and that can create attachment issues. So
Yes.
as you are carrying a child, as you birth a child, if you've experienced neglect, abuse, abandonment, hurt, pain, and depending on if it comes from a primary caregiver,
Mhm.
someone who you expect to nurture you and you trust and they're there for you, it's going to certainly interfere potentially, not always, but in a lot of cases, how you show up in your ability to parent. And until those stressors or issues are rectified or worked through, it may interfere in different ways. And so, if there are moms out there that are struggling with that, I hope that they can identify people in a caring circle, someone, an aunt, a grandmother, a sister, girlfriend, to say that, this is a lot, this is heavy, you're dealing with a lot. Perhaps you should seek out help for that.
Yes.
And when they begin to sort of unveil or pull back the layers, they then can be better available to attune to their child and to develop that secure attachment and bond. And it's not too late. I tend to, my preference is children, because I feel that early intervention is key, and the prognosis is much greater if I can capture them at 3 or 4 or 5.
Yes.
Then waiting until they're adults, a lot has been done and a lot of patterns have been established.
Right.
But, again, a message of hope and optimism. It isn't too late to identify those things that you may have experienced in your childhood that affect your ability to parent well. And I would say, again, family therapy, individual therapy, parent-child, didactic work. There are some intensive programs out there that do that kind of work that can help a parent through their own childhood trauma and to be better able to, attend to their children.
Now, why do you think just getting the help or just getting the resources is really has become kind of hesitant to do so, especially in our community? A lot of times, a lot of people don't want to talk about mental health, or you said it really well when you said pull back the layers. A lot of people don't want to pull back those layers because it takes us to a hurtful place. It takes us, now we have to revisit a place that we had subconsciously put under the radar, put under the rug. And so now I have to put all my stuff on the table just so I can get so I can be able to be free and whole and be able to operate in a different way. So why do you think in our community, first of all, there's not a lot of education. Honestly, when you think about it, we're just getting to a place that we're talking about mental health. It's been in families for years, and people would just, turn a blind eye, pray about it, read something, you'll be all right, put it up against the wall, stop, just don't deal with it. And we internalize that thing, and it comes out in different ways.
Sure.
So a lot of times, like right now, I love the fact that I've been hearing about mental health now, especially since COVID, more than ever. And I think it's great because people perish because of a lack of knowledge. We're not being educated, and we look at it as a bad thing. Like, a person that with cancer or a person with kidney failure will have more compassion than a person with mental health issues, and they'll look at that person with mental health issues, look at them funny, but they'll have compassion with the person that has cancer.
Sure.
So, why do you think our community is set up that way? And that while we look at it as a bad thing and not a thing to kind of tap in the resources so we can help one another?
I think historically, when you think about us as a people, historical trauma is real. It is showing up more and more in clinical places. When we think about pre-slavery, during slavery, how we have often been conditioned to keep things quiet. We don't speak up, we don't speak out, we don't say for fear of repercussions. And so sadly, that has been embedded in us as a people over time. And that historical trauma piece is real. And you think about watching folks who did speak up and what they may have seen as a result of that. But I think that, as we have approached the 21st century and thinking through um, trying to normalize this sense of it's okay to get help. We know that mental health issues can stem from, having a predisposition. If it's in your family, then there is there's a chance, a percentage that you may develop mental health issues. It's not for certain, but it puts you at greater risk. And so talking more and more about seeking help for those things that really sometimes are completely out of your control. If you think about, um, some of the mental health diagnoses and disorders and getting treatment. It might mean talk therapy, or it might mean medication, or it might mean group therapy. So trying to, normalize it and to treat it just like you would any other medical condition, as you mentioned. If you have diabetes, then you take, or your glucose level is high, you take your levels
That's right.
each day, or you get treatment for that if you have high blood pressure. So I think the medical field is doing a lot more collaborating with the mental health field, because it sort of becomes this comprehensive approach.
It does. Yeah.
Just pushing those things out. When doctors are doing your physicals, they're checking in, checking up. How are you feeling? You might hear that more and more
Yes.
from your medical doctor.
Mm-hmm.
And so it's a method to why they're engaging in that discussion, because either they're referring you to someone or suggesting you go see someone, or at times they may start the treatment for you, but then get you to a a psychiatrist or a therapist to do the ongoing work. So I do think that we are moving more away from the stigma. And I think with, this younger generation,
Yeah.
they have more exposure to things, which can be good in some ways.
Yeah.
And so being sort of presented with information on what is mental health and what does depression look like and what you can do about it, and different ads that are posted on social media and encouraging people to get help, and also celebrities even coming forward, or athletes, about this is what I'm struggling with.
Yes.
So I think, and this is what I'm doing about it, and so can you. So I think the media platforms can be really helpful in that sense to, help people seek out the help that's needed. So I
Yeah.
think we've come a long way.
We really have, and it's just a conversation. It's just educating ourselves about the topic. Now, what would you say to a woman that might be speaking, that might be listening now, that's really going through anxiety? Um, Anxiety has really been a hot topic,
Mm-hmm,
especially since COVID.
mm-hmm,
Anxiety and depression,
mm-hmm.
and you have sometimes people don't even know that they're in a place of depression, or know
Sure.
that they're in an anxiety. Their anxiety is high.
Mm-hmm,
So what does that look like? When a person is depressed, they can't put their finger on it. They just don't. They're just not themselves.
sure.
And what does it look like when a person has high anxiety and they just
Mm-hmm,
can't cope with
mm-hmm,
certain things and triggers,
mm-hmm.
things that might trigger them into being that mind space?
So in the clinical world, we look at a couple of things. We all, to some degree, have the blues or the blahs, or we get down and out periodically.
Yes.
And that is perfectly normal. The way that our mind works, and we have a lot at play with the brain and the function of the brain. And so if you're feeling down and out because there's been a loss, that's normal. If you're grieving the loss of a loved one, if you've lost a job, or if you've had a disagreement and disconnected with a close friend, you may feel sort of down and out about that. But what we look at in the clinical world, when it comes to a diagnosis, we look at the duration.
Mm-hmm.
So, how long are the symptoms lasting? The level of intensity,
Mm-hmm.
and whether it's impairing functioning. So, we look at a few things. And so, if you are feeling that it's lasting more than 2-3 weeks. You can't get out of bed. You're not able to do the activities that you normally have engaged in. You're struggling to interact with loved ones, friends. Then that's when we'd be looking more at, okay, that may be depression, a diagnosis of depression.
Yeah.
When we think about anxiety, we all get stressed, like thinking about giving a talk or presenting, you may feel like, a little bit of butterflies. That's normal. And a normal stress helps you sometimes propel you into, I got this, I can do this,
Yes.
and you get it done.
Yes.
But when it comes to, again, looking at severity, are you feeling so anxious that you can't get out the door to get to work or get to an activity? Are you repetitively engaging in something that, where you're feeling stuck? Are you feeling completely overwhelmed where your breathing is heavy, you're sweating, having palpitations? And is that lasting for a lengthy period of time? And so it really is about looking at the symptoms and, severity and impact on functioning. And if those things are occurring, I would say to women out there, you definitely don't want to sit with that in isolation because it can worsen and become more severe. And we don't want women getting into a place of feeling stuck. Reach out, access those safe adults in your circle, contact your primary care doctor. They will get you to a therapist, a psychologist, or a licensed clinical social worker, someone that can treat, an LCPC, licensed certified professional counselor. Also, I would suggest with your insurance, whether it's Medicaid or Aetna, United Health, all insurance cards will have a number where you can access mental health providers in your area. So just reaching out in those ways and checking online. The internet is a good resource.
Yes. Because the resources are out there.
They are.
You should put your hand to the plow and looking for them.
Mm-hmm.
So, what made you? What was your motivation to get into your study of mental health? What was your? I call it the paradigm shift that make you say, "This is what I want to do every day."
So I am the oldest of 6 children, and I've always been a helper as long as I can remember. I actually attended Morgan State thinking I would be the next Oprah
Okay.
doing telecommunications.
Yeah.
And I got to my junior, senior year, and I said, I think I want to do something different.
Okay.
And my parents were like, what? Are you going to change? And I said, no, I'm going to, finish. And then I sat out for about 3 years, got some case management experience, and decided to go back and do a master's in clinical social work.
Yeah.
So I've always had a desire to help and make an impact and affect change. And, I knew that was the direction to go in order to do that. So,
have you had any situations through your study and your experience that really was like, oh my God, but it ended up being a good thing or it worked itself out? Or, I mean, of course, I know we can't name names, of course not, but I'm just saying any situations that really just kind of just took you and just kind of made you see how real this thing is.
So there are times, obviously when I'm working with students and families and, when I think about the impact of trauma, it's real. And when I have kids, who are, I remember a number of years ago when I was doing heavy duty trauma work, I was expecting and ready to go out on maternity leave. And one of the clients said, please don't leave me like my mom did. And I thought, wow, I'm just going to have my baby. I'm not, and it was interesting. Being in foster care, they looked at me as sort of a primary, seeing me once a week for 50 minutes. That was a constant for them. And so that right there was a huge wake up call to let me know that trauma is real and attachment issues are real. They feel that sense of abandonment, that deprivation and loss. And me just going out on leave for a few months, was critical to them. They felt like another caring adult is sort of abandoning me, if you
Yeah,
will.
yeah. And the
So,
thing I've learned too is it grows up with you. It
sure.
grows with you.
Hmm.
So
If
we
it's not addressed, absolutely.
exactly, if it's
Hmm.
not addressed.
Hmm.
And that's why it's so important to confront those things and to try to address them and allow so it won't spill over to the next generation or spill
Sure.
over to as you know they become adults
Hmm.
because a lot of us are dealing with things that we did undealt with things from our childhood
Right.
that we just never dealt with and just thought it'll go away because it's not there anymore, but it's still there. It's
It's
still
there.
it might not still be active, but
Right.
it's still kind of even active because it's regulating who
Mhm.
we are.
And
And
it shows up in different
it,
ways at
it really
different
does.
times.
It really
Hmm.
does.
Hmm.
How do you deal with and I'm not gonna say patients, but people you might work with that just don't want the help? They just don't want it. How, and I know you work with the children, so like with parents that you might have to
Hmm.
talk to that's just like totally in denial, not my
Hmm.
cat, not my kid.
Hmm.
And just how do you deal with that? How do you process that as a caring person? And then
Sure.
yeah, how does that work with you?
There are times that does come up where parents are in denial, and my job is really to put the information out there.
Mhm.
This is what I'm seeing. This is how it's impacting functioning, and hope that at some point they'll be ready. And it might be a pivotal point where a child does something really severe that it shows up in school or it causes them to go, whoa, okay, I get it now. So
Yeah.
you just put the information out there in
Mhm.
hopes that they will grab hold at some point.
Yeah, and that's all you really can do.
Hmm.
It's the same in ministry. You put
Sure.
it out there and you just pray that people get it. Um, and my last question for you today is: in your line of work,
Hmm.
are you a mandated reporter?
I am.
Okay, I
Hmm.
figured that.
Yes.
So, have you ever been in a situation that you had to do that? And how did that make you feel after the consequences of whatever was done?
So I've had to make uh, child protective services report in my, you know 20 some years of work,
Yeah.
and it's difficult. However, what I've tried to do as a practitioner is we have such a great rapport from the outset. And in any good clinician and ethically, you should be making clients aware that, when they sign that confidentiality, um, paperwork, that there are exemptions to
Yeah.
this. And if, you are in danger of being hurt, or in harm's way, then we do have to make a report. And so when you disclose that from the beginning, you have a good rapport. I try to also, if the opportunity has presented itself, to make the client aware this is what I have to do in
Yeah.
order to keep you safe.
Yeah.
Um,
Definitely.
so just kind of that communication piece and
Yeah.
forging the connection around this is what I need to do and why. And it's tough. You think about how hard it is, and um, but I think in the end they understand
Yeah.
why, especially if I've
Definitely.
kind of set the tone.
Definitely. And the communication piece is so key in that.
Hmm.
Um, and I did say that last one was the last question, but I do have one. What would you
Okay.
say to um, a woman, the women now, as far as how to manage their stress and how to
Hmm.
manage um, their low times,
Hmm.
where they will be able to manage through it so they can grow through it and not
Sure.
stuck in it. What would you say to that woman that said, hey, Chandra, I'm stuck. I've been in this place for a while. I just don't know how to get out.
Hmm.
I'm in a really
Hmm.
low place. I've tried
Hmm.
to pray it through. I tried to do everything, but it's
Mhm.
nothing's working. I don't know what to do.
So I would go back to kind of where we started with the self-care piece,
Mm-hmm.
thinking about the notion of you have to take care of you in order to care for others.
That's it.
And, I'll use the metaphor of when before the plane takes off, you need to put your oxygen mask on first,
That's right.
in order to be able to care for anyone else. So thinking about noticing those moments where you're having a tough time, where you need a reprieve, where you need the support, what can you do to balance day to day, or have little nuggets of, you time or a balance, um, trying to put some routines and rituals in place for your children so that you're not feeling completely overwhelmed.
Mhm.
And just taking a little bit of time to do what builds you up, whether it's reading a devotional every morning, which I do that in the bathroom, but
Yeah.
nobody needs anything at that moment. It's taking a walk. It
Mm-hmm.
might be sitting out front for 5-10 minutes.
Yes. All that stuff works.
Sure, journaling.
Mm-hmm.
So those things can be really helpful. And I would say to the women who are feeling like they're at an all-time low, to try not to stay in that place. Reach out, connect with somebody in that caring circle. And if you don't have a caring circle, try to identify people that you feel could be in your caring circle. Reach out and get help and get support. And if you can't do it, see if you can get someone to align with you, to be your ally and help you, your pastor, your church member, your sister, a cousin, a friend, a neighbor, so that we don't stay stuck in that place.
Exactly. And do you know any resources that you could just name, maybe a couple of organizations that
Sure.
some
Um,
in that place could reach out to for help?
Absolutely. There is, let me just make sure I have this website,
Okay.
the womenshealth.org.gov.
Okay. Let me talk.
That's a good resource. Um, Also, the Maryland Health Department is a good resource
Yes.
as well. And then when it comes to resources for children, healthychildren.org, which is done by the American Academy of Pediatrics,
Okay.
and Children's Mental Health Matters.
And have you came across a lot of kids, especially now through COVID? That's the question I didn't ask you. Since COVID, that's really gone through a lot of mental health challenges because they've been isolated, no type of socialization. Have you had to deal with that a lot?
Yes, absolutely. Obviously, this has been this past year, like none other. And I think we have all felt the brunt of COVID and are experiencing COVID fatigue.
Yes.
And children are definitely in a position of, they're home or they're um, less engaged in social activities. They're not with their peers, as have been a lot of adults. Um, I would certainly say in this past year, we've seen more stress and anxiety and depression in children than we have in quite some time.
Is it getting better now that I mean, we're not really out, but
Hmm.
I guess most of
Trying to get back to some sense of normalcy.
yeah.
I would have to say, I think that there is progress. I know that government agencies, national agencies. This is one resource I failed to mention, SAMHSA.org, and I can always get these to you.
Okay, please do.
But
Thank you.
they, it's the Substance Abuse Mental Health Services Administration through the federal government. There are lots and lots of resources out there for families and children. And so mental health therapy has picked up tremendously.
Mhm.
And especially given, the governor's allowing us to do telehealth work through
Yeah,
phone, through video, through chat,
that's right.
FaceTime. They lifted a lot of those orders around the confidentiality pieces, because typically we wouldn't do it over a phone call, but
Exactly.
they wanted to make it accessible so that anybody that wants treatment or therapy, mental health therapy, can get it.
And I
So we've
think they
seen an
might stay
increase, to
there.
answer your question. We have
Yeah.
seen an increase, but we've also seen a boost in services that are being offered and access.
And I think the access, well, I'm assuming, I hope that the access for the virtual piece will stay in place
That
because,
would be a nice thing to keep around.
yeah, it really was. It's accessible, it's convenient,
Mhm.
and a lot of times when a person is in the moment,
Sure.
they don't have time to
Get
wait.
in a car. Yeah.
Yes,
Yeah.
you
Yeah.
know what I
Right.
mean.
Right.
So I just think it's more beneficial. Listen, I thank you so much for
Thank
coming,
you.
spending some time with us here at the Journey of Womanhood, um, and sharing your heart and the things that you do on a daily basis. I want to thank you also for being a frontliner for
Thank
the
you so
people and
much.
the young people that are in need and doing the things that you're doing. It is so helpful and beneficial, especially during this time that we're going through right now. If there anyone who wanted to ask you any questions or wanted to connect with you, how would they do that?
I can be reached via email, ChandraCowling@gmail.com, and I'll make sure you have that information, and or my uh, phone number. Would you like me to share that now?
I send it out.
Okay,
Yeah.
perfect.
I'm gonna send, I'm gonna have a just to let the ladies know. I'm gonna have like a resource sheet
Awesome.
with everything that we talked about this week, with different resources and contact people that they can reach in the time of need and other
Awesome. And
resources. Yeah.
I'll make sure you get the resources that I stated a little
Awesome.
bit ago.
Because that's the issue. People don't know, or
Right.
they might didn't do the research, but the resources are out there. The help is
They
out
are.
there. It's
They
just
are.
it's just finding the help. But I want to thank you again so much. I'm so grateful for this connection with you. You're such a sweet spirit.
Thank you so much for the invitation. I
Yes,
appreciate it.
definitely. Thank you for coming. And listen, ladies, we are going to be back here on on Saturday. On Saturday, you all join us on Saturday. We are meeting at Watkins Park. And we will be walking. We will be walking and empowering each other in honor of mental health. Exercise is a great way, you know, to to get yourself together and to empower yourself, and a great way to clear your mind, and a great way. So we'll be doing that on Saturday. We will have a rain date if it rains, but I will definitely give you all that information. You all don't forget, we'll be here again on next Tuesday, and next month is Music Appreciation Month, and we will be speaking to a lot of all women musicians in the DC area, vocalists and musicians. And our theme for next month is called The Women Behind the Music. And I have some wonderful, talented women on the roster. So you all tune in, and don't forget to tune in and just keep in touch. I love you so much. I love you so much. Listen, Miss Chandra, thank you again for joining
Thank you.
us, and just have a wonderful day.
You as well. Take care.